Surgical Unit and Nursing. MedSurg is the #1 specialty as many professionals choose to work in the field of surgery in the country. Medical surgical nursing can be defined as a specialty that provides care before and after surgical procedures. The MedSurg is a fast-paced environment due to its intense work and variety of patients revolving around in and out of surgical operations. Nurses in the medical surgical unit often have a variety of tasks that change from day to day based on its extremities. According to the Academy of Medical Surgical Nurses, or AMSN, the goal of the medical surgical nursing specialty is to promote, maintain, and restore the health of the client in accordance with the best evidence available. Whatever they do, they play an important role in the patient's before and after care.
What are the requirements and qualifications for medical surgical nurses? So education consists of earning both associate degrees in nursing and Bachelor of Science in Nursing. The ASN is a 2-year degree that includes coursework and lab work that allows you to take the certification exam for RNs right after. The BSN is a 4-year degree containing science classes and clinical practice. While a Master in Science in Nursing is not a requirement, it helps with critical thinking and prepares you to take more responsibilities in the future. Additionally, 30 hours of continuing education in medical surgery nursing within the past 3 years is needed in order to work in the field. Regarding the training, as a MedSurg nurse, you are to hold a current or active RN license and have been working full-time as an RN for 2 years. For training, you are going to need at least 2,000 hours of clinical practice in MedSurg surgery nursing within the past 3 years.
So what does MedSurg entail? MedSurg nurses provide direct care for patients suffering from a variety of illnesses and ailments. They tend to patients who are acutely ill, suffering from disease, and getting ready to go into or out of surgery. Some examples of what they do are changing IVs, dressing wounds, and preparing patients for surgery. The medical surgery unit is a very fast-paced environment where nurses have to think quickly on their feet and make quick-paced decisions that could save a person's life. They must master all skills in case of an emergency where any kind of skill can be needed.
Medical surgical nurses perform interventions before and after medical procedures or surgeries. Different types of interventions are used by nurses in order to properly assess and inform patients how to take care of themselves, what to avoid, and how to do better along the rehabilitation or recovery journey. There are 3 types of interventions. An independent intervention are actions that nurses may perform on their own, such as repositioning a patient or checking on vital signs. Dependent interventions are tasks that are reliant on a physician's order, such as the prescription of medication. An interdependent intervention is an action that consists of both nurses and physicians working together. Nurses are tasked with preparing patients for the operating room, making sure they are in the right conditions to undergo surgery, as well as giving immediate care for patients coming out of surgery. They follow routine plans but also administer medications that were ordered by doctors. Nurses focus on creating an environment that allows and supports the patient's needs in order to make a healthy recovery, not only physically, but mentally and emotionally as well.
The pros and cons of MedSurg. The pros consist of having the opportunity to work with patients with a variety of conditions, constantly expanding knowledge and skills. MedSurg highlights critical thinking, organizational, and communication skills. You are actively working to give your patient a higher quality of life, which is incredibly fulfilling for both the nurse and the patient. MedSurg nurses have a great health care, a comfortable salary, a reasonable overtime compensation. There is flexibility as you can pick your schedule and when you want to go in. However, MedSurg is a high-pressure and overwhelming working environment. It can be mentally and emotionally taxing. You have bad days where you lose a patient, complications, and unsuccessful surgeries, etc. Burnout occurs as MedSurg nurses are responsible for multiple patients and are constantly juggling responsibilities and duties. Parents and families can cause you stress and make you feel frustrated. MedSurg can contain long-hour surgeries and long days, which is exhausting.
In conclusion, working as a MedSurg nurse entails caring for patients before and after surgeries. Gaining the specialized title requires the nurse to have at least 2,000 hours of clinical practice within the MedSurg unit, with some specific practices including changing IVs and dressing wounds. Though working in the environment is rewarding and provides patients with quality care, the MedSurg unit can be high pressure and overwhelming.
Medical surgical nursing is the single largest nursing specialty in the United States and beyond. From admission to discharge, MedSurg nurses are on the front lines of care, making sure the patient journey progresses without delays or gaps.